Today I'll talk about the signs and symptoms for acute cholecystitis patients. Before starting, we have to know that in acute cholecystitis we have the rule of 5 Fs. 5 Fs means the acute cholecystitis affects more female more than male. This is the first F. The second F for 40, so it affects the patients in the middle age groups in the fourth decades mostly. The third F for fat. Fat means obese. Obese patients more common to have acute cholecystitis than others. And may you ask why? Why? Because they secrete a bile that is super saturated with cholesterol. So there will be a disturbance in bile salts to cholesterol ratio. Okay? And the fourth F is fertile. Fertile means that female patients or male patients, but more commonly female patients, she is in childbearing age. And the last F is for fair, and fair means that it is more common in Europe and North America than Asia or Africa. Okay, so let's consider that this is like introductions for the signs and symptoms of acute cholecystitis patients. So patients come with acute cholecystitis, how she or he will come to emergency room. I'm sure that you know that patients with acute cholecystitis probably had a history of previous biliary pain which ends spontaneously. Okay, so this time I will draw and for the first time a female patient because it affects female more than males. Okay, so a female patient, how she will come. Okay, female, she is 44 years old, it's considered that, comes to emergency room with a really severe epigastric pain. So now I told you the first symptom that makes a patient comes to emergency room, which is the severe epigastric pain. Okay, now let's consider these patients is what? It's obese female. Okay, she's not obese like that. Okay, tamam. So patients female, 44 years, come with epigastric pain, and we have to ask the patients that how the pain started, where it started, and where it goes then. So patients with acute cholecystitis, the pain will start from the epigastric region, then it radiates to the right upper quadrant or to the right hypochondrium region. Okay, to the right hypochondrium region. Let's imagine this is the ribs, and here the gallbladder. Okay. So the first symptom is epigastric region, epigastric pain, radiate to right hypochondrium or right upper quadrant region. Okay. And when as doctors, for sure, we will ask the patients if the pain radiates to another regions, and of course, patients with acute cholecystitis mostly will answer that yes, the pain radiates where to right side, to the right shoulder, to the right scapular region, okay, or to epigastric. Yes, so it starts in the epigastric region, then go to the right, then it may radiate, okay, to the epigastric and to the right shoulder and to the right scapular region. So yes, she will answer me. The pain firstly was in the central region, epigastric region. Then it localized in the right hypochondrium region, or as the patient's language, she will say that it radiates or goes to the right upper quadrant region here. Okay, and it radiates then to the right shoulder, plus right scapular. Okay, radiating. Okay. What else? This obese patient. Then for sure, we'll ask her about her appetite and her food type and if the pain is associated with the eating or not. And patients with acute cholecystitis, I know that you know that it is related to eating, especially if the food was fatty food. So patients will say, yes, after I eat fatty meal, the pain really be severe, okay? So the pain is associated with the eating. So the patients will come to hospital, to emergency room with loss of appetite for sure, because she will have fear of eating. Okay, so what? And yes, the patients will say that not only pain after eating, plus she will say that after eating I became vomit all what I ate. Then even when I didn't eat anything, I vomited yellow color vomiting, okay, or material. So loss of appetite, maybe. vomiting. What else? As its name indicates, acute cholecystitis. So there is inflammation. There will be fever in patients. In patients, fever. Maybe more than 38 Celsius. Okay. Okay. What else? So the pain was in the central gastric region, then localized in the right upper quadrant, and it radiates to the right shoulder and right scapular region, and it is associated with eating, especially fatty foods. Okay, and the patients are really afraid from eating anything because after eating, she vomites. Okay, and even if she didn't eat anything, she will vomit too. And as it's inflammation, so there will be fever, also nausea, vomiting plus nausea. This is something يعني so relatable. Okay, what else? Yes, when we ask the patients how the pain came, suddenly severe or it's gradually increasing, the pain is the patients will answer that the pain is suddenly came and it was so severe. But we will ask her if she has lately any pain in this area, in the right upper quadrant or in the epigastric area, and the patients will answer there was a pain that came after eating a fatty meal, but the pain was not really severe like this pain and was not constant, and it was just for less than 6 hours after eating. Then it's spontaneously relieved. Okay, okay, okay. So this is these are the symptoms for patients with acute cholecystitis. What about the signs? What about the things that I may see in the patient? Okay, we may see a mass in this region, and this mass not will be in the gallbladder because of the obstructed gallbladder, and the obstructed gallbladder will accumulate the mucus and leads to mucocele and will lead also to empyema because the accumulations of pus has inflammation. So we may find a mass. Okay, right upper quadrant mass. And what else? If we document the fever, we may find it. What else? Maybe the acute cholecystitis complicated to perforation and then leads to peritonitis. And peritonitis, so the patients will come with peritonitis symptoms like shallow breathing, and the patients will try to minimize her movements as much as possible. Okay, and if I compress on this area, I will what? Or she will what? She will suffer from really severe pain. And if we did the Murphy's sign, and this is a sign that is specific for acute cholecystitis patients, we put our hands in the right iliac region, and then we will moving it upward. Each time the patients take a breath, then exhale it. Okay, as we go upward, if the patients, while we compress the right region and go upward, if the patients suffer from sudden inspiration cessation, okay, because of the severe pain while we compress in the area upwardly, so this is a positive sign for acute cholecystitis. Okay. Okay, what else? Okay, maybe the cholecystitis will be complicated. And what is the complications of acute cholecystitis? One of the complications of acute cholecystitis is that the stones in the gallbladder will descend to the cystic ducts or to the common bile duct, and if it descended into the common bile ducts and stuck there, the patients will have symptoms for obstructive jaundice. Okay, obstructive jaundice plus acute cholangitis. And in the last video, I told you about symptoms of obstructive jaundice, which is jaundice for sure in the sclera, pruritus. What else? Pale stool and dark urine. Okay, and maybe cyaturia. What else? What is the complications? Another complications for acute cholecystitis? Yes, and the jaundice it is not because of the obstructions in the bile duct. No, maybe it is because that maybe. Let's draw. What? So this is the gallbladder, and here is the stone. The stone stuck here in the neck of gallbladder or in the cystic duct, and it compressed the common hepatic duct. Okay, if it compressed the common hepatic duct, also this will lead to what? To jaundice. Okay. So as a complication also for acute cholecystitis, the stone may be stuck in the neck of the gallbladder or in the cystic ducts, and this will lead to jaundice. Okay, and this signs we call it what we call it? We call it Mirizi's syndrome. And the patients come with symptoms for complicated acute cholecystitis, like right upper quadrant mass, like peritonitis symptoms. The patients trying to not move as much as possible, and abdominal rigidity. Okay, and maybe the stone stuck in the neck or in the cystic ducts, so it will compress the common hepatic duct and will lead to syndrome that is called Mirizi syndrome. Okay, I forgot to mention that this is a syndrome that affects the liver here because of obstructed common hepatic duct, and it is called what? Mirizi syndrome. Okay, and another reason for jaundice may it obstruct or distend the sense of the common bile duct and leads to obstructive jaundice and acute cholecystitis. The patients may had pruritus, may had alteration in the color of urine and the color of stool to pale stool and dark urine. Okay, okay, and that's it. So don't forget that it affects females more, 48 ages, and fat, obese patients, and what female 40s fats fair in Europe and in Europe more than Asia and Africa, and it affects also what it affects fertile patients that she is in childbearing age. Okay.